I think this is more myth than truth. There's actually the converse that is true in many veterinary studies to show that desexing animals can be protective against forming future cancers. And although hormones can play a role in other health parameters, I don't think that should outweigh the benefits of protecting against future cancers. That's actually very true. So unfortunately, many individual breeds are afflicted by specific cancer incidences that are much higher than their counterparts. So for example, Scottish Terriers get a very high rate of bladder cancer. Golden Retrievers get a large percentage of lymphoma diagnoses made on a yearly basis. Rottweilers are affected by bone cancers. Bernese Mountain Dogs get a disease called histiocytic sarcoma, and you can go through them pretty much one by one, and various breeds certainly have a predilection to certain types of cancers, obviously through a genetic component. I think that there's probably a spectrum of truth in answering that one, but it's not as clear as myth or not. But I would say in general, in older animals, a lump or a bump most likely is a malignancy. I think on balance, I would say that this is a true statement, although there is a spectrum, of course. You can't be tunnel vision with any presenting lump or bump, but in an older animal, just like in people, cancers is generally a disease of older animals, and you'd have to be highly suspicious of a malignancy in that setting. That is a myth. Cancer treatment is generally considered a multimodality approach, and that would include surgical options, radiation therapy options, chemotherapy, as well as immunotherapies, making use of antibodies and vaccine strategies to target various malignancies as well. I think what's important in answering this question as a myth, which it is that our philosophy in treating pets is quite different to what it is in people. So although we are using many of the same treatment modalities, our approach is not as aggressive because we value quality of life above all else. Certainly, we're always after longevity for our patients, but not at the expense of their quality of life. And it's very important that we don't do anything treatment-wise that's actually worse than their disease. So although there are some mild adverse effects that can be seen, these are generally mild and self-limiting and nothing like what people experience.